Hi, my name is Angie Guns, and I'm doing my medication presentation on furosemide, and I am in school to be a
nurse anesthetist.
Good job. All right, so again, I'm doing furosemide, which is the generic name is furosemide for a loop diuretic. The brand name and trade name is called Lasix, which we all may be a little bit more familiar with. Most common loop diuretic. The most common loop diuretics are furosemide, bumetanide, torsemide, and ethacrynic acid. Now, ethacrynic acid is the only loop diuretic that is not a sulfonamide-based loop diuretic. All the other 3 of the 4 that I listed are sulfa-based, so they may have, patients may have allergies to that. You know, you've heard of sulfa allergies, just something to be aware of. So the mechanism of action of furosemide is it is a loop diuretic. Now, loop diuretics inhibit the sodium chloride reabsorption in the thick segment of the ascending loop of Henle. And more specifically, they inhibit the NKCC2 cotransporter. NKCC2 stands for sodium, potassium, so it's 1 sodium, 1 potassium, and 2 chloride ions. And typically, your NKCC2 cotransporter is on the lumen side, and then you have that cotransport in of the sodium, potassium, and chloride ions intracellularly. So then intracellularly, you have an excess of potassium. So you actually have back diffusion of potassium out back into the lumen, and this creates a positive electrical, what am I looking for? Electrical potential in the lumen side, and that's what normally happens. So when we inhibit this NKCC2, we inhibit the sodium, potassium, don't touch that, Joe. We inhibit the sodium, potassium, and chloride from entering the cell, so you don't get that, don't do that, babe. So you don't get that excess intracellularly, therefore you don't have that back diffusion. Please don't do that. Therefore, you don't have that back diffusion of potassium into the lumen side, which gives you your increased urinary excretion, your increased sodium, chloride, and potassium, magnesium, and calcium excretion in the urine. Now, a secondary mechanism of action of the loop diuretic furosemide is also that it induces the expression of cyclooxygenase COX-2. And so what COX-2 does is you have synthesis of prostaglandin. So this prostaglandin, specifically PGE2, inhibits salt transport as well in the thick segment of the ascending loop of Henle. So, it does the same thing that your loop diuretic is already doing in kind of its primary mechanism of action. So that's just an additional. So something to be aware of is that you don't want to mix with NSAIDs because NSAIDs inhibit COX-2. So they could potentially completely inhibit what your loop diuretic is trying to do in the first place. So just absorption and excretion. We're almost done. So increase absorption and excretion of the loop diuretic furosemide. It's rapidly absorbed and excreted by the kidney via glomerular filtration and tubular secretion. And you can see more of that on my slideshow in PowerPoint because my kids are getting a little antsy. So then just a question that I have for you, to skip ahead here, is what is furosemide's secondary mechanism of action in relation to the cyclooxygenase COX-2, and what medications should potentially be avoided with the use of loop diuretics and why? And to answer that, furosemide and loop diuretics aid with expression of cyclooxygenase, particularly COX-2, and thus prostaglandin PGE2 specifically synthesis. So the PGE2 inhibits salt transport in the thick ascending loop of Henle, which gives an alternative mechanism of the diuresis action of the loop diuretic family. So you're going to use with caution in NSAIDs for example, as their mechanism of action are cyclooxygenase enzyme inhibition, and they interfere with and possibly completely blunt the loop diuretic drug effects. All right, Jojo, you wanna get up? So Joe here is a nurse anesthetist, right? You stand up. Where's your shot? And Blakey here is the patient. Joe's just gonna give Blake a little furosemide here. Oh. Are you not going to anymore? Okay, you want Mama to? Yeah. Okay, all right. Blakey, can I have your arm? You wanna give her a shot? Okay, I'll put it on. All right, ready? Give it to her in IV there. How's that feel? Pretty good? You feel normal? Okay.
Dad, go potty!
And that's our presentation.